I think beauty is a philosophy. So it's really, I think it's how you feel and what makes you feel confident and comfortable in your own skin. And
Like when you see it, you just know it. It like resonates on a certain wavelength inside you that when you look at it, you know what it is.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Keith Blechman, who's known for his patient-centered approach to both cosmetic and reconstructive surgery. He specializes in breast reduction, breast lift, and transgender and non-binary top surgery, including chest masculinization and breast augmentation procedures, combining advanced surgical techniques with compassion and individualized care. With nearly a decade in private practice, Dr. Blechman has become a leader in opioid-sparing post-operative pain management and is widely recognized for creating an inclusive, affirming environment with patients of all backgrounds. I also have Dr. Krishna Vyas, who is a plastic surgeon at Blechman Plastic Surgery and Breast Surgery Group in Manhattan, with surgical training at Harvard, Mayo Clinic, and Johns Hopkins. He is double fellowship trained through the Aesthetic Society and Harvard's Massachusetts General Hospital. He serves on the American Society of Plastic Surgeons Technology, Innovation, Disruption, and Entrepreneurship Committee, and its Quality and Evidence-Based Initiatives Committee, where he understands how emerging technology is reshaping aesthetic medicine. He has authored more than 200 peer-reviewed publications, sits on the editorial boards of several leading plastic surgery journals, and is a plastic and reconstructive surgery journal top reviewer. So Dr. Blechman, Dr. Vyas, welcome and glad to have you both.
Glad to be here.
thank you.
Yeah, so let's start from the very beginning. How did each of you get interested in the medical field?
Why don't I start? I can't remember when I decided I wanted to be a doctor, but it happened, I think, probably in high school and into college, applied to medical school. I actually ended up becoming a public high school teacher before I went to medical school. I joined Teach for America, which I still use a lot of those skills today, but I finished up that commitment, went to medical school, ended up there. And then I think it's actually a more interesting question might be like, how do we end up becoming plastic surgeons? Because that decision was sort of one that had some complexity to it. If you told me I was going to be a plastic surgeon my first day of medical school, I would have laughed at you. It was just through some chance encounters and seeing some of the at New York University, where I did my medical school, where I went to medical school, just seeing some of the wild operations that were being done regarding complex reconstructive facial plastic surgery that really got me into it and exposed me to the whole world of plastic surgery. That's very broad and what makes it really interesting to practice.
Okay. And Dr. Vyas, how about yourself?
Yeah, so I'm from Eastern Kentucky. My dad is a urologist and just retired a few years ago. So he trained in India, and then I was exposed to medicine at an early age, mostly from my relationship with him, and just really felt like there was a connection with the community and the positive impact that we could have as providers and doctors on like overall community health. And so that was my first introduction to medicine. And then I went to college at University of Kentucky and then did an MD PhD there. And that's probably the time when I started to discover an interest in plastic surgery. I didn't know much about it before. Um, and I really like started to focus a little bit on the translational component of how we can translate basically basic science interventions into like plastic surgery innovation. And really understanding that it's a problem solving specialty that we as surgeons are like looking at problems and then trying to like find solutions to them. So for me, it was like really the background and research that got me interested in plastic surgery specifically. But I think I've always known I've wanted to be part of the medical field.
Okay. Now, Dr. Blechman, you decided to start your own practice, Blechman Plastic Surgery. What led you to decide to start your own practice?
It's kind of interesting. It's another thing. My career has kind of taken these strange turns of suddenly changing on a dime through some chance encounter. Like I told you that I decided to become a plastic surgeon after happening to be in the operating room with a doctor named Dr. Joe McCarthy, and I never even thought about doing plastic surgery until I saw him doing this operation in front of me. And then I eventually went to residency, and my intent was to basically go work in a what you would call a tertiary medical center doing complex reconstructive plastic surgery. A place like Sloan Kettering, for example, in New York City, doing just reconstructive plastic surgery for patients with cancer. In fact, when I did my fellowship, I did my fellowship at MD Anderson Cancer Center in Houston, Texas, and all I did was plastic surgery on people with cancer for a year. It just so happened at that time, I was very intent on it. I wanted to either move back to New York, which is the area where I was from, or my family was from, or back to either LA or San Francisco, because I had a lot of friends in California, and there just wasn't jobs in those kind of places. And I was trying to find some opportunities, but it's kind of funny. I had this conversation with a guy. I was actually, of all places, I was in Taiwan, Taipei, at a plastic surgery conference, like this international plastic surgery conference. And at that time, I was graduating from my fellowship in just a couple of months, and I had this job lined up in LA to do some like breast cancer reconstruction, but I also had like a mentor of mine from New York just happened to like tell me, I have some space in my office if you want to rent it from me. I knew nothing about like starting my own practice. So I'm in Taipei and I'm at this conference and we go out and I'm with some of the other American plastic surgeons and I'm kind of talking to one of the I think he was her spouse or her boyfriend or something. And I'm kind of telling him my dilemma. I didn't know what to do, whether like go to New York and just like hang a shingle or go to LA to this kind of like sure thing, but they weren't offering me a very good deal. Let's put it that way. And the guy, his name was Mark, and he turns to me, he goes, I have an answer to your question. And I said, okay, how do I figure this out? And he goes, well, I have a lot of friends who've started a lot of businesses, and a lot of them have done really, really well, and a lot of them have gone bankrupt. He goes, but ultimately, you got to just decide where you think you should be. And he said, where, and he just said it to me very simple, like, where do you want to be? And it just came out of my mouth in New York. And so he says to me, well, then go to New York. I don't know how you're going to figure this out, but go there and start your practice however you need to do it. And the worst thing that'll happen is you'll fail. And this is America, and you'll brush yourself off and start again. And so I basically just literally, I got back from, I was still in Texas doing my fellowship, got back. The first thing I did was called the guys in California and said, I can't come. And I called Dr. Naidu back and I said, hey, let's sign a sublease. I had no idea what I was getting into. And it was so hard at first, but I survived the first 5 years of torture of starting a practice by yourself in Manhattan. But that's really where it came from.
Okay. And now that you have this practice, you specialize in gender affirming surgery. So for
Yeah.
people who don't know what that is, can you explain what is gender affirming surgery?
Sure. And that's another like serendipitous thing in my life where I had never done that operation in residency. It was only because I was doing breast cancer reconstruction and someone came into the office once and said, "Can you remove my breasts?" And I said, "But you don't have cancer." And then kind of started to understand what was going on. So gender affirming surgery is a term that can mean a lot of different things, but generally speaking, we treat a lot of patients with something that's called gender dysphoria, which is basically people who just, it has many different manifestations, but quite simply just don't feel comfortable in the body they're in from the standpoint of their gender. And so that is a very complicated process for a lot of people to navigate, and it can be navigated in many different ways. So we provide healthcare for them that helps them navigate any kind of surgical path they might take. but we specialize in just the chest and breast area. We do a little bit of facial stuff. We
Mhm.
don't really do anything below the belt. It's just a little, not that we can't, but it's just our resources don't make it very easy for us as far as like we don't work inside a hospital and this kind of thing. It's a little more involved, those kind of operations. But the chest and breast stuff is very straightforward for us to do. And we've become part of the community, at least in the New York area. But people come, we've had patients come, I think, from 46 different states to
Wow.
see us for
Mhm.
this. So it starts to, because ultimately, we do a good job. We know what we're doing. We create a safe environment for people. People in this community know they can trust us. And the word spreads, actually.
Mhm.
It's actually
Okay.
really, it's like beautiful, actually.
Mhm. Now, for people who are considering this type of surgery, what are some of
Mhm.
the main things that they need to know or that you kind of wish they knew before they came to you?
Krishna, you want to answer maybe?
Sure. I mean, so that was a beautiful description, just that, gender affirming surgery is really aligning a person's physical characteristics with their gender identity. And it means a lot of things to a lot of different people. So really like having a good understanding and a good relationship with the patient. And that's part of the beauty of being a plastic surgeon is understanding like what does the patient want, what are their expectations, what are their goals. And so, obviously it's a complex topic, as is most medical care, and safety is the number one priority. But we really want to understand like what's the driving force, like what will make your physical identity most concordant with like your emotional well-being as well. So, the most important thing is knowing that like you have providers who are there for you, who understand your goals, who can be supportive, and really to communicate that with the entire team. So it's not just the surgeon as the isolated person as part of a medical team. It's also, medical assistants. We have a support staff like physician assistants as well, and really the entire care team that helps to deliver a positive experience to the patients because it's just a welcoming environment. People want to feel supported. There are a lot of uncertainties, and it's kind of scary to come into a like doctor's office who you've never met, and kind of like say, "Hey, this is what bothers me," and try to communicate those goals and fears in anticipation. A lot of people have never had surgery before. So, just going through that process of discussing like what is anesthesia like and what does recovery look like. So there are a lot of, things that are a little bit uncertain to come in, and that's totally okay. That's why we're here. We're here to be supportive and to like make you feel comfortable.
Okay.
There are also some concrete things that we need to do for there's just general things that need to be done before any type of plastic, or really to any type of surgery, and those include just obviously meeting the patient, evaluating them, seeing what they need to do for them, and then everybody in some way, shape, or form is going to need some kind of preoperative workup from a medical standpoint, and usually that's as simple as a physical and some basic blood work. But depending upon somebody's medical history, they might need perhaps an X-rays or MRIs of something. They might need to see other specialists like a rheumatologist, a cardiologist, even like a breast cancer specialist, something that we spend a lot of time on and that Dr. Vyas has been really doing pioneering research on is understanding the intersection of breast cancer risk and people who undergo what's called top surgery, basically transgender people or non-binary people who are undergoing the operations that we do, whether it be chest masculinization or breast augmentation, because it's kind of like a black box still. We don't really know enough about that. So these things, need to be thought through, medically evaluated, determined whether the patient needs to do these things before having surgery to ensure a safe and predictable surgical environment, as well as a safe and predictable outcome after surgery. Now, something that is a little bit specific to gender affirming surgery is that there are certain guidelines, mostly that are dictated by an organization called the World Professional Association of Transgender Health. And in our practice, one of the most important things is that we do want to get the input of a qualified mental health professional before we do these operations for people. These are, life-changing surgeries that cannot be reversed. If we remove someone's breast to masculinize their chest, we can't. I mean, we could reconstruct their breasts, but we would never be able to return to them the breasts they were born with. Okay, so we do want to get the input. of a qualified mental health professional. So that is like a special part of what we do. And that's generally what people should expect. There's also certain things that do require patients to understand, which is sometimes hard for them to they know, and I know this in advance. They may have to wait some time before having surgery. Now, why would that be? Well, a couple of things. A lot of people are on GLP-1s now, losing a lot of weight. They're in the midst of like major weight loss journeys. We don't want to operate on a moving target. It's a great way to like miss the mark and like almost like it's almost like getting your clothes tailored to like someone else's body, right? So you want to talk to them about that. People need to be in a stable place regarding their weight. That could be for as long as 6 months sometimes. Um, some people are smokers. We know through decades of research that smoking can lead to all kinds of wound healing problems after breast and chest surgery. So we need people to be not smoking, whether that's cannabis or tobacco, for usually at least 6 weeks before and after surgery to be safe. So there's a variety of things we really need to allow for thorough medical history taking, physical examination. We don't like rifle through patients all day. We only see a relatively small number of patients each day and devote a lot of time to really understanding their medical history, and so that we can make sure, and which we do have, very predictable, safe outcomes for people.
Mm. Okay. Now you went through quite a few of what goes into the process, but for people who have no idea what this entails, what's the time frame that you would say is a good estimate for them to anticipate, like from the very beginning, and then you talked about like the psych profile part, then maybe like if they're going to do something health wise, then maybe to finish until that's done, and then getting the actual surgery, and then also recovery time. Like, what's a good time frame people can expect for the entire process?
Krishna?
Yeah, so it really depends on the particular surgery. Some things that we do are procedures. So those are small things that can be done awake under local anesthesia that may not have like a long lag time. For example, if you get to know the patient's goals, you have a good relationship with them, they have reasonable expectations, you're able to, predictably deliver a result. It could be an upper eyelid lift, for example. You could just do under local anesthesia in a procedure room. That could be done like fairly quickly, even in, a week or something like that. Obviously, you want to make sure everyone's medically optimized. So when it comes down to general anesthesia, meaning that you're going to sleep for the surgery, that entails a little bit more risk, which means that you would meet with an anesthesiologist generally the morning of surgery. You also meet with, not all practices do this, but in general, you'd meet with your primary care doctor or sometimes other subspecialists in order to get a preoperative medical clearance. That part can take some time. Some body parts or operations need additional imaging or workup. As an example, if you've had prior abdominal surgery, maybe you need imaging or a CT scan of your abdomen. If you are of a certain age, you may need a mammogram or imaging of the breast. So it kind of depends on the surgery, and it also depends on your medical history. So patients who are a little bit more medically complex, maybe they require 6 weeks, 8 weeks, or even longer, depending on like the referral patterns, the process, and also like the environment that you're in. So it really depends on the history of the patient and kind of what their needs are. It could be as early as like a month. It could be as late as like 6 months plus, just like Dr. Blechman was referring to. If someone's actively like losing weight or they're anticipating a pregnancy or something, you don't want to be chasing after a moving target. So it kind of depends on a lot of the individual circumstances.
Okay.
It also depends on the practice's just administrative flow and cadence. So at our practice,
Mhm.
we have a really big team. We deal with a lot of our patients in one way or another might use their health insurance. So we have like very clear protocols and pathways that patients go through, that we know, okay, for this operation, for this type of person needing this kind of stuff, we know we can put you on the schedule in 4 weeks, or we can put you on the schedule in 8 weeks. It's like we minimize the amount of people having to reschedule. Let's put it that way, because things aren't done in time. And you were asking about the time interval after surgery too. That's also going to be unique to each individual. Some operations, a lot of the chest and breast operations, actually any kind of operation for the most part, you're going to have most of the healing happening in the first month or two. But something that is a little bit of a foreign concept to many patients, unless they've had surgery before, is that even though you notice most of the changes happening in the first month or two, it really takes the human body about a year or two to totally stay stabilized and settle in. And it's a really important concept in surgery, particularly like in revision surgery. There are some people that for one reason or another might need to have another operation to fix a little something or whatever it might be. And oftentimes we'll tell people you got to wait. You got to wait another 6 months because we got to let the tissues soften up because you haven't actually finished healing yet, not only on the outside of your skin, but underneath too.
Okay.
So, and it has a different effect in terms of, not effect, but depending upon what the patient does for work, what like getting like the term like the recovery time, it's very ambiguous what that means. It's better to have like pointed questions like when can I go back to work? Well, what do you do?
Mm.
Do you work from home in front of a laptop, or are you a professional rock climber? There's going to be a different answer to both those people, right? Even though the healing time might be the same in both. It's sort of like a different perspective in terms of how that healing time interfaces with their life.
Got it. Now, when it comes to the gender affirming surgery we've been talking about, it's very, sounds like very specialized in what you do in doing this. Now, what's really the benefit of someone going to a specialist when it comes to plastic surgery versus someone that's a little bit more broad in plastic surgery? And I'll play a little bit of a devil's advocate. It's like, well, if you're a plastic surgeon, you can do all plastic surgery, right? So, what's really the benefit of going to a specialist?
I'll just start and then I'll hand it off to Krishna. They had this phrase I heard when I was in medical school or residency. It said, "You can be a jack of all trades and a master of none." Now, that can be great if you're perhaps the only plastic surgeon for 500 miles in any direction. And yeah, sure, you go to residency, you'll learn how to do everything from fixing cleft lips to putting fingers back on. But we are literally in the middle of Manhattan. I'm looking at Central Park out the window. I mean, there's a plastic surgeon at every block around me. It's probably the highest density of plastic surgeons in the world. So you better be pretty good at what you're doing. And I gotta tell you, no matter how good anyone is, I know a lot of plastic surgeons, you can't be good at that many things. Okay. Like most of us who are successful and that patients know they can trust that they're going to an expert, we have a certain menu of things. And hopefully we have the humility to like send to a colleague something that they could probably do better than us because they do more of it, you know. It doesn't mean that it's bad to like have someone do a bunch of things, but it's just what it is. That if you do a lot of things, you can't focus on any one thing. Anyway, Krishna, what I mean, do you agree with me?
Yeah, 100%. I think that was very well articulated. Just that plastic surgeons are very broadly trained, maybe more broadly trained than a lot of specialties because it's head to toe, all genders, all ages, basically all tissue levels, skin all the way like down. So it's like very broad specialty. Of course, we're problem solvers. We see a wide range of complications in training and very complex cases that are multidisciplinary. So there are tons of benefits to plastic surgery training. Then, as you start to grow and evolve as a surgeon, it is unique and interest and like good to subspecialize in something because then you really become an expert in a field and you start to identify trends, you start to see how things can become better in your own results or others' results. You start to see things that maybe other people don't see based on repetition. So, like, experience definitely matters, volume definitely matters. Specific to top surgery, just, wider range of chest anatomies. Refine techniques as you do more cases, more consistent, predictable outcomes, for example, because there's like a steady flow. There's a defined time that you would, kind of predict that you're going to be able to perform a case in the operating room. Your aesthetic judgment may change. You're familiar with up-to-date guidelines, for example, the WPATH guidelines or other multidisciplinary care guidelines that are present. So, as we kind of mentioned earlier, also, like, there may be cases that you have revisions. And as you start to become more familiar with the index operation, you start to see like, cases where you may need revisions or other providers are sending you revisions, and they can be complex. And so you want to be familiar with like how do you approach that problem? How do you solve it? And then finally, I would end on that once you start to become like more of a subspecialty expert, besides just identifying those problems in a clinical capacity, you're also like starting to ask questions that are more research oriented. So you start to say like, okay, I have a question about a specific patient intervention, comparator, and outcome, for example. So one thing that we also subspecialize in is like nerve or sensation preservation, which is sort of an advanced technique where we're trying to save some sensation in the chest after surgery, which may otherwise be numb, or at least altered in sensation. So that's like one thing that maybe like a lot of providers may or may not offer. A second thing is just higher screening for breast cancer. Like I will admit, like before I joined this practice, like we probably weren't doing as intense screening as necessary for a lot of patients who are undergoing like chest masculinizing surgery. And so one thing that we've been focusing on in the practice here is distinguishing like mastectomy, where you're removing a lot of breast tissue or all the breast tissue for either cancer prevention or treatment, from like a chest masculinizing top surgery where there's still breast tissue remaining. And then there are tons of questions that go along with that. Like, when do you start screening after surgery? What is kind of the estimated breast cancer risk after surgery? So I think the more that you start to see patterns and trends and individual patients and complexities, the better that you can be as a provider. So definitely being a specialist helps with judgment and also familiarity with guidelines and actually trying to implement and change practice.
Okay. And when it comes to myths or misconceptions, I'm sure you both hear a lot of myths and misconceptions about your patients or from your patients about this surgery and these treatments. What would you say some of the most common ones that you hear?
Well, I don't think I think what I struggle with most, it's interesting that what I struggle with most is photos that patients, one, either want to show me or that I show them. And that's because like photos are indispensable, obviously. And they do represent a very good tool to show patients what's possible. But what they represent is this two-dimensional snapshot of a three-dimensional body that exists in time. And meaning it can move around, it could be at different angles, all this kind of thing. And also, it exists in time in that, as I was alluding to earlier, the healing process is not just it's over in a week. Sometimes it could take 2 years for the healing process to ensue. So it depends when those pictures are taken. And even if I show somebody a picture of another patient that has like the X, Y, and Z dimensions are almost exactly identical, which is extremely rare to find. But if you did find that, like they had an identical twin, the thing you can't show in a picture is what the properties of their skin are. Maybe the other person lost a lot of weight, and so their skin's a lot more like it doesn't snap back. It's not as like it's more lax is a word we might use in surgery, and that could lead to a radically different result, especially in plastic surgery because it's the skin that we're typically operating on. So it's always interesting when a patient wants to show me a picture because usually my next response to them is, well, like, they're like, I want to look like this. And then I tell them, well, can you articulate what this is? And most of the time, they're like speechless. They don't like know how it's like I know what they're talking. I know generally what they see, right? But they have a real hard time telling me, well, it's that the relationship of this anatomic unit to this is a certain is this different than on this side or whatever it is. And I tell them, go home, stare at this. Try to figure out like what are you trying to impart to me? Because in plastic surgery, it can get really difficult sometimes because it's almost like the patient and the doctor can be both playing a game of guess what I'm thinking. And then there's this third party in the room of like nature and how the surgery is going to actually heal and what's actually going to be possible. So pictures can be useful, but they can also create a lot of like false expectations, maybe, unless they're properly discussed. That's for me the biggest, some like in terms of like myths or misconceptions, that's where I kind of find myself dancing around that when people show me pictures of things.
Okay. Dr. Vyas?
Yeah, I completely agree. In addition to everything that's been said before, that a lot of people think, okay, my like activity restriction is for a month and therefore this is the final result. But definitely results take months, if not up to a year plus, to for the tissues to settle, for scars to mature. Scars are forever. That's another misconception is like, obviously they are forever. They don't go away. They may improve with time, but a lot of it comes down to genetics. Some of it comes down to like, obviously the technique and the aftercare, like silicone taping, for example, but the scars are forever. And so it's important to just know that sometimes they can widen, sometimes they can thicken, sometimes they can form kind of like masses or keloids. So, and then finally, one surgery is not necessarily guaranteed to be everything. There is a certain percentage of patients who may need a revision for something like a standing cone or loose skin or asymmetries or contour irregularities, scar revisions. Those are things just to like, talk about and consider. There are risks to all surgeries that go from extreme to kind of minimal, but obviously they're all important and they're all important to talk about and kind of just ask questions. But I would agree with Dr. Blackman as well as like photos are a great communication tool. But it's important to know like what about an aesthetic result does someone really like? Is it about the scar shape? Is it about the positioning? And so there's a lot of like directed questions that we have to kind of ask and that also the patient has to impart to us.
Okay. And when it comes to the future, where do you think the future of plastic surgery is going?
That's a great question. Krishna, you ever think about that?
Yeah, I'm very excited about this topic. So cut me off in a minute. Yeah, I think like, there's obviously a lot of translational innovation happening in plastic surgery. Again, like the to me, plastic surgery, and they teach us this in the books, I didn't create it, but it was like that plastic surgery is a problem-solving specialty. So we're always like thinking and trying to like find solutions to problems. And one of the most exciting things is that, and sometimes frustrating, is that you can put 100 plastic surgeons in a room and ask them like, how would you address this problem? And you may not always get the same answer. There are many ways to address a certain problem, or even if there's no problem, like an aesthetic result. People do breast reductions in many, many ways. People may address top surgery in different ways. Um, Obviously, rhinoplasties, facelifts, there's always arguments about deep plane or not deep plane, and then like, high definition lipo or not. And so there's compression after liposuction or not. There's so many things that we just don't know. So I think the future is for me more evidence-based medicine and like practice guidelines that kind of instill some sort of um, more direction in like is compression useful after liposuction or abdominoplasty or tummy tuck, or is it, going to contribute to more complications? So once we start to have more structured data and outcome measures, then we can more predictably inform patients about like what are the expected complications. So that's just something practical. And then obviously there's the innovative part of plastic surgery where we're looking at like organ transplantation, for example, with like multiple tissue types, or I mean, some of the original plastic surgeons were doing a lot of the transplantation surgery. So as a discipline overall, we're always looking for like solutions for something like wound healing, scar maturation, aesthetic improvements, reducing complications, developing practice guidelines, and just like kind of, reducing overall complications, improving predictability is probably the biggest thing for innovation. But it really depends. I think from basic science to public health intervention, really there's like this huge window of opportunity for plastic surgeons to be part of society.
I also think it's just getting more popular because it's for two reasons. I think that it's just more accessible. First of all, I think there's more plastic surgeons. For better or worse, there's more people who are not plastic surgeons practicing plastic surgery. Um, there's also, I think, just people have more money to spend on things like plastic surgery. People are more willing to discuss it on social media, making it more normalized, if you will, than it might have been 30, 40 years ago. And I think that people are getting operations that they never would have thought they would even entertain. I think more and more people who are like in their 40s are getting facelifts. Um, there was a very famous plastic surgeon named Dan Baker who said the people who do the best, who have the best results from plastic surgery are those who need it the least. And that quote has always like resonated with me because yeah, like maybe it's best to get a facelift in your 40s because it's actually going to be the most like subtle, easy thing to do. That'll sort of maintain some degree of youthfulness as opposed to really trying to make this huge dramatic difference at age 70, which is hard. And so, yeah, I would imagine that we're just going to see more and more people doing plastic surgery or having plastic surgery in the future.
Okay.
The market
Well,
will probably grow.
sounds like it's a bright future ahead then for plastic surgeons.
Yeah,
Okay. Well, I do have one last question for you both, but before I ask it, I do want to point people to your website at BlechmanPlasticSurgery.com.
that's correct.
Now, last
It's
question. Yeah.
Blechman, just like a K.
Yeah. Okay. Now, last question. What does beauty mean to you?
Oh, wow. Should I go first on this one? What does beauty mean to me? I think beauty is something that it's like almost like a feeling. Like when you see it, you just know it. It like resonates on a certain wavelength inside you that when you look at it, you know what it is. And it's not something that's easy to put into words. I think it's something you just, yeah, it's a thing you know when you see it.
Okay.
Yeah, I think um I think beauty is a philosophy. So it's really I think it's how you feel. And what makes you feel confident and comfortable in your own skin and just having a sense of identity and just like freedom. To me, that's beauty because you're able to live life authentically and like then, hopefully without more stress. So it's like beauty is something that's very individualized. It means different things to different people, like Dr. Blackman was referring to. It's just something that's a bit ethereal, but for some people is very, um, it can be defined, it can be articulated, and there are ways that people can work on their inner and outer beauty, self-improvement, or even like guided meditation. And obviously, there are the physical manifestations that can be changed as well. But ultimately, it comes down to like a core philosophy of identity and just like living authentically.
I can give an example. Chris and I were just talking about this earlier. We were discussing the placement of the nipples when we do top surgery. In other words, when we do a chest masculinization. So we're removing the breasts and then we're making the chest look more masculine, and we want to choose the position of the nipples. Now, there's all kinds of studies you can read about how many centimeters this should be from that and all kinds of relationships. And I never use that stuff anymore. I sit them up, I draw on their chest, I stand at the foot of the bed, cross my arms, cock my head a few times, different directions. And I just sometimes I redraw the stuff and I just know it when I see it. That looks best. You can't like there's no way to like mathematically explain it. It's just like you just know it. Let's put it there. Put them, let's finish the operation.
Very well said. And there you have it. Dr. Blechman and Dr. Vyas sharing their expertise. So if people want to learn more about you or contact your practice, what is the best way for them to do that?
Just go to our website, Blechman Plastic Surgery. You can easily reach out to us through there. There's also a phone number if you want to call. Our staff are very responsive, and we can easily get you set up with some information from some of our staff or a consult with one of us.
Excellent. Well, this is great. Thank you both for coming on. Thank you for sharing your knowledge and your expertise, and also thanks for sharing your message.
Thank you.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.